It's a deadly virus that has made its way to the United States and has been dominating the headlines ever since. And with a fatality rate of nearly 50%, healthcare employees need to be prepared for if and when Ebola hits Michigan. The Ebola virus is a deadly disease that was first discovered in Central Africa in 1978. The infectious and highly fatal virus is marked by an intense fever and severe internal bleeding. The virus has killed nearly 5,000 people since its original outbreak, but has only been diagnosed in 4 people in the United States, who have all either visited West Africa or had close contact with an Ebola patient.
Fortunately, we don't have the virus circulating in the community, and therefore the awareness that the virus is not in the community is important. If a patient is suspected of having Ebola, it's probably going to be because there has been a travel history of that person having traveled to West African countries.
Which has many U.S. citizens wondering why a travel ban has not been placed on people flying back to the United States from West Africa. Since the outbreak has spread to the U.S., there has been heightened fear and social disorder surrounding the virus. But Michigan hospitals, including Henry Ford Macomb Hospital, says they are fully prepared.
Henry Ford Health System has invested a lot of resources in making sure that we continue to protect our own employees and the community at large if we do happen to have a patient who may have contracted Ebola. And in that regards, we have the emergency room centers and the urgent care centers and any other point of contact with the health system. The awareness of our healthcare providers is very heightened. They are quite familiar with what to look for, what to ask for, and more importantly, what to do from there on.
So what do they do when and if Ebola is found in Michigan?
We have a strategic plan based on meetings with the team members for a strategic team to isolate the patient as soon as we can identify the person and then have them transferred to a designated area at Henry Ford Hospital in Detroit.
Fortunately, catching Ebola in the U.S. is less likely than people believe. And with no current cases in Michigan, it's not certain the virus will necessarily ever affect our state.
At a national level and the state level and at the health facility level, we have measures in place that such a person would be very quickly identified and isolated from exposure to other family and community members. So therefore, the chances of somebody who lives in this country, in the state, in our community, to come into contact with somebody with Ebola is extremely, extremely unlikely.
Reporting for Shelby This Week, I'm Ciaramitaro.